Is being active an important strategy to employ in trying to prevent and remediate cognitive decline? And what does being active mean?
Yeah, that's a great point. So absolutely, being active is very important. And I think many studies have come to the same conclusion. Now, as far as what that means, that's a very good point, because you have people who will just do a little walking. Yes, it's better than nothing, but you really do want to get your heart rate up. You really want to get the blood flow. As Steve was referring to earlier, blood flow is critical. These people typically aren't having enough support for their brains, and that includes blood flow and oxygenation and mitochondrial function, as well as their trophic support. So yes, staying active, very helpful in general, but we'd love to see people get somewhere between 30 and 60 minutes, somewhere 3 to 7 times a week of having significant activity and getting their heart rate up to, getting up to 70% of maximal for that period of time, whether you're doing it through, Peloton, or whether you're doing it through HIIT, or whether you're doing it through something else. One of the interesting things that's come up, I mentioned, EWOT this morning, but that's one of the ones that's actually been pretty interesting. And another one is these restriction bands, with some of the Olympic athletes used, which reduce blood flow a little bit to the limbs, and basically you respond. So you get a little more bang for your buck in terms of the improvement with that amount of exercise.
Yeah, and activity is not just about physical activity too. What is very helpful to reduce risk of Alzheimer's disease and progression is social activity, where people are interacting with each other. And this is to be encouraged. It's also very helpful with Parkinson's disease, where you have, for instance, ballroom dancing, which has been found in many studies to be really helpful. And first of all, it's hard to fall down if someone's holding you up. And second of all, there's a lot of interrelation going on between people. And then you're getting some good exercise too. I don't know if you can quite get up to 70% of your maximal blood, but maybe.
We started out and you said that overnight it was good to fast for 12 hours, 12 to 16 hours. What about longer fasts that are like a 48-hour fast, a weekly fast, a several-week fast? And would that be with green juice or with water? And is there a benefit to longer term, meaning from 1 day to 3 weeks, of either water fasting or green juice fasting? Is there any information, studies, or science on this for Parkinson's or Alzheimer's?
Yeah. Steve, you want to comment on this?
Yes, fasting is an art and a science. And there's something called Buchinger fasting, which is highly developed in Europe. And it's actually, they're taking in about 200 calories per day from juices, freshly made juices, mostly vegetable juices, keep the glycemic load down, and also broths and teas. And this has been done in metabolic wards as well as at home. It's been studied quite a lot. And what's very protective about this type of fasting is the large amount of antioxidants that are being taken while a person is fasting. Now, Ray Dorsey, I'm sure, would agree that our fat cells have gotten some of these persistent organic pollutants into them. And while we're fasting, we're burning our fat cells, and these persistent organic pollutants get into our bloodstream. It's very nice to have some antioxidants and anti-inflammatories in there to stop them. I am not a proponent of water fasting. It's known as starvation fasting. And I think in the 70s, it pretty much was shown that it was inferior as far as protecting people during the fast. Certainly you get fast results with water fasting, but it's also much more dangerous. So fasting with the broths, the juices, and the teas, the broths are very nice. Like a potato broth is very alkalinizing to the body, which the bloodstream tends to try to become more acidic during a fast. And it's very nice to have this soothing broth along with it. So I would suggest that if people are going to fast, that they do that. However, in Parkinson's disease, especially in the later stages, we have weight loss as one of the big problems. So you would not want to fast if you were already low in weight, of course.
Yeah, and if I could just add, I think this is a field unto itself, as Steve alluded to. There are a lot of variables, a lot of issues. And again, we see Alzheimer's as a network insufficiency ultimately. And so taking a system that does not have enough support, whether it's oxygenation, vascular flow, mitochondria, all these things, and then saying, now let's remove the support for it, that is a really scary thing. So where we find it most helpful is in people who are a little overweight and they have some degree of insulin resistance, and we're helping them to become insulin sensitive, and we're helping them to become metabolically flexible. That's where I think it can be very, very helpful. Of course, it has good effects on things like blood pressure, for example, stem cells, for example. So there are some good things, and you might consider the fasting mimicking diet that Walter Longo developed. I think that's a reasonable thing to consider. As Steve mentioned, making sure that you have some antioxidants on board, very helpful. So we are very careful about that for people who have low BMIs. If you're down at 19, 18 BMI, I am very worried about having you be fasting. I'd rather see you kind of slowly work up to it. And again, start with some exogenous support and then ultimately move to where you can do this, truly what is intermittent fasting, although I realize that's a controversial term because we're all fasting right now. We're all intermittently fasting, but we're talking about a little longer than your typical amount. So I do think it is a field unto itself, and you have to be very careful and look at what's driving your neurodegenerative process before you decide just overall this is the cure-all for neurodegeneration.
And to go one step further, what I would like to see is people move toward a nice plant whole food diet. And that's going to provide the benefits of fasting. Some of the best benefits of fasting are not getting the animal foods in the diet. And of course, in the Buchinger system, as any well-developed fasting system, you want to slowly decrease your dependence on heavy foods before you begin the fast, and then break the fast very gently with the lightest of foods, and then gradually return, hopefully not to your prior diet, but to one that's a little bit lighter than your prior diet. For me, I would prefer that people start changing their diet to a much healthier diet. And one of the problems with fasting is the lack of fiber. And even with 200 calories a day and with juices, there's not much fiber in there. And that increases inflammation, as it is fiber that drives our microbiota to make the short chain fatty acids that feed the inside of our large intestinal cells. That is necessary to reduce inflammation in the gut, and as we all know about the gut-brain axis.
Yeah. And is there a role for fasting in Parkinson's?
Steve knows probably way more than I do. I really just haven't seen that much, but I just don't know.